Hey there, Dr. Morse, Injury Experts. So sitting here at the Akron airport on a delay, figured I'd discuss what happened to Hollywood Brown last night. I did a video last night, but now we have more information and I can be a little bit clearer. This is a very rare and unique injury. There's only been two that I'm aware of, Danny Amendola way back when, and Tyreek Hill back in, I think it was 2019. When you land on your chest or your shoulder, usually you injure the AC joint up here. That's where the clavicle comes across and attaches here. But sometimes the force is so strong, usually in car accidents, that it actually dislocates not from here, but from here. And this, if we pull up this picture right here, the issue with this injury is that there's so much force needed to create this injury that the ligaments that hold the collarbone to the sternum either tear or get sprained, and it's really painful. And there's two ways it can go. It can pop out towards the front, which basically looks like there's a little bump right there. That's the most common. Or you can pop out the back. That's called a posterior dislocation. The problem with a posterior dislocation is that this does not specifically have a lot of room behind the sternum, because there's a lot of important blood vessels that are in the sternum area that feed into the heart. So basically what happens is you can actually tear some of those blood vessels that feed into the heart. Usually the patient dies immediately. Obviously that's not what happened here. He ended up getting evaluated on the sidelines. They saw that it was urgent enough, brought him to the local trauma hospital. He was evaluated, probably underwent imaging like a CT scan, x-rays, maybe even MRI, and then it was determined that he did not need surgery. This morning he was cleared and then allowed to return home to Kansas City, which he has. So what are we dealing with here? We don't know if this is an anterior dislocation or a posterior dislocation. My bet is an anterior one. They've said that week 1 is in jeopardy, which translates to this is at least a grade 1 or mild, or maybe even a grade 2 moderate. Here's how I see this going. One of two ways. The first way, he got lucky. He's at risk for missing week 1, possibly week 2. The other scenario is this is more moderate and they have to be careful with him, so they'll start him on the PUP or whatever they want to call it. And he would probably come back after their bye week, which I think is week 6 or 7. So that would kind of derail him the first month or 6 weeks of the season. As a result of this, we're going to see a bump in Rashee Rice, who I love this year, value, and because I don't think he's going to get suspended in 2024 because of the timing of his legality issues. They won't be even in court until November, and they'll probably delay it. Also, Xavier Worthy is going to get a big spike. And yes, it's, you know, he's a little risky in his own right because of his hammies and other things, but I think both of them are relevant and appropriate. That's where we're at right now. I don't think they'll probably give us a whole lot of updates on Hollywood because he just needs to heal and it needs to scar back down. And then he's a brittle guy, so I have concerns about him in general. And he's had foot injuries, he's had a bunch of injuries, and now he's got a new kind of rare injury. But you know, Tyreek back in 2019 or whatever year it was had a fantastic season after that. I think he played in 10 games. He was like over almost 800 yards or something like that. So I'm not overly concerned about it in the long run, but in the acute run, there's a chance he misses the first couple of weeks. So he might be a little bit of a value depending on how it plays out over the next couple of weeks. Hopefully that was helpful, and we'll do more of these intermittently. This will be both on the Injury Experts website as well as the YouTube channel. I'll probably put it on X as well. Thank you for tuning in. See you.